The meeting for House Appropriations Subcommittee on Health and Human Services will come to order. Clerk, will you please call the roll?
Chair Morse.
Here.
Representatives Martis. Here. Hood. Braybeck. O'Neill. Puri. Here. Farhat. Price. Skaggs. Snyder. Here. Green. Present. Bolin. Here. Meerman. Here. Kuhn. Steele. Here. Madam Chair, you have a quorum.
Representative Snyder moves to approve the minutes of March 15th, 2023. Hearing no objection, the minutes are approved. So welcome everybody. Today we are happy to be having a presentation from the Department of Health and Human Services for the 2023-24 Executive Recommendation for Public Health. So we'll be hearing from the department as well as a couple other individuals who are engaged in that work. So I would be happy to call forward Dr. Sarah Lyon-Callow and Amy Epke of the department.
Good morning, Chair Morse and members of the subcommittee. I'm Amy Epke, Senior Deputy Director of Financial Operations at the Michigan Department of Health and Human Services, and joined by Dr. Sarah Lyon-Callow. And we're pleased to be here again today to continue the discussion on the fiscal year 2024 executive budget. And in a minute, you'll hear about 3 key investments that are included in the executive budget recommendation for the Public Health Administration. You'll hear about a safe drinking water investment. You'll hear about an investment in public health support, both at the local and state level. And then you'll also hear about an initiative around community health and equity. In addition, we want to briefly touch on this morning also a supplemental that you also have seen as well as part of the executive budget package. And primarily we want to touch on this because we have as a state received a number of federal grants in the Public Health Administration, which we're very excited about. But in order to actually access those dollars, we still do need that supplemental appropriation at the state level. So we look forward to continuing to work with this committee and others both on the fiscal year 2024 budget and also the supplemental that is pending as well. And with that, I will go ahead and turn it over to Dr. Lyon-Callow.
Thank you and good morning. My name is Sarah Lyon-Callow. I'm the Acting Senior Deputy Director for Public Health Administration at Michigan Department of Health and Human Services, and thank you so much for the invite today. I'm grateful for the opportunity to present, going to describe a little bit about public health in our state, how the system functions, some of our recent accomplishments from the Public Health Administration, and talk about some goals for the upcoming fiscal year. So the Michigan Department of Health and Human Services has different administrations. The Public Health Administration is then made up of different bureaus. So the Public Health Administration is responsible for a vast array of public health services and coordinates with the state's local health departments. The administration is composed of these 5 bureaus shown on this slide. Each has specific functions that are tied to meet our public health needs in the state. For instance, the Bureau of Health and Wellness coordinates integration among internal programs, the public, healthcare providers, and community service systems to leverage resources and improve population health outcomes, including chronic disease and maternal child health programs.
Dr. Lyon-Callow, is the mic on, or maybe can you sit a little closer?
Sure.
Thank you so much. No, it's okay. Thank you.
Thanks. Is this better? Yeah. My apologies for that. Okay. Oop. All right. Our Bureau of Laboratories ranks 6th in the nation, providing testing for public health programs, including testing of clinical and environmental specimens for communicable disease and investigating human exposure to environmental health threats, as well as testing for disorders of the newborn period. The Bureau of Infectious Disease Prevention conducts and coordinates statewide communicable disease surveillance, response, and prevention activities, working to build and support public health and local health department capacity. Michigan's Public Health Code provides the department and local health departments with co-equal duties to protect the public's health. The state of Michigan has 45 local health departments representing 1 city, 30 counties, and 14 multi-county districts. Local health departments are considered the primary organization responsible for the organization, coordination, and delivery of those services and programs at the local level. So the department and local health departments, as well as other state agencies, work together constantly. So I want to talk a little bit about the MDHHS Public Health Administration. We have several accomplishments over the past few years. I wanted to highlight some of those recent activities. Last year, nearly 1.2 million children enrolled in the Healthy Kids Dental. This is our statewide dental program that helps Michigan children under the age of 21 who have Medicaid enrollment have healthy smiles. We also saw almost 13,000 pregnant women receiving dental care. We continue the fight against lead exposure, including abating lead hazards in the homes of 1,300 individuals. The Women, Infant, and Children, or WIC program, continues to provide a necessary safety net for families, with 1,200 mothers, babies, and children participating in the program every day. Our involvement in the Michigan Syringe Service Program has resulted in nearly 10 million syringes distributed since October of 2018. This program has proven to reduce the harms of substance use to the individual and the community, and to reconnect community members to help empower them to make positive changes in their lives. And last year, the state lab and 4 regional labs completed 7.3 million tests for Michigan residents, ranging from genomic sequencing of tuberculosis bacterium to testing for toxins out of harmful algal blooms. And we also added a new screening test for spinal muscular atrophy to the state newborn screening panel. Did want to talk a little bit more about the laboratory. The department is extremely excited about the development of our state public health and environmental science lab. This modern building will provide capability and capacity to safely test and report all kinds of health and environmental exposures due to epidemics and future pandemics with scalability. The new building design is currently in progress with the funding provided from the $150 million FRF dollars, and groundbreaking is expected to begin in September of 2023. So we hope to carry over many of the accomplishments we saw last year, and there are many opportunities in public health we're looking forward to achieving. So as Amy mentioned, today we'll be discussing 3 of those primary areas: ensuring safe drinking water, scaling local public health resources, and promoting community health and equity. We have observed an increased focus on providing safe drinking water as more have come to understand the threats to drinking water and the impact of infrastructure underinvestment over time. We intend to continue coordination between community system operators, our partners at local health departments, and other state agencies to ensure access to safe drinking water. With $100 million, Michigan Department of Health and Human Services will continue to support water filter distribution, faucet and plumbing replacement, and necessary lead investigation and abatements in homes. The short-term remedy of filter distribution is a necessary first defense to protect people from exposure to lead in drinking water while lead abatement and infrastructure changes are made. The proposed FY23 budget includes funding within the Michigan Department of Environment, Great Lakes, and Energy to assist communities with addressing water infrastructure needs. Similarly, the proposed budget invests $52.5 million in support, including $30 million to local health departments and $22.5 million for Michigan Department of Health and Human Services. The $30 million would add necessary support for locals to fulfill their statutory mandated services, including drinking water, food protection, and infectious disease control. The additional $22.5 million would enable Michigan Department of Health and Human Services to improve monitoring and response to environmental public health threats, including investigating drinking water contamination and supporting Michiganders impacted by contaminated water. This would improve the ability of public health professionals to proactively address threats to the health of Michigan residents. Inequities and disparities in health outcomes remain significant, persistent, and for many of us deeply concerning. We have observed Black females being almost 3 times more likely to die as a result of pregnancy or childbirth compared to white females. These inequities are driven by preventable differences in social structures, economic systems, and policies. With recommendations from the Racial Disparities Task Force, we can promote community health and equity. The proposed $57.9 million would go toward public health efforts, including $2.5 million to support sickle cell services that would improve access to counseling, support groups, and other necessary services to individuals with sickle cell and their families. $10 million would be used to improve our equity data, expanding data collection and processes that assist us in understanding and addressing disparities in health across the state. $18.1 million would be used to create local health community zones. MDHHS would offer technical assistance supporting local communities as they create and implement long-term strategies that would address inequities in access to healthy foods, affordable housing, safety networks, and other social and health outcomes. $25.3 million would be used to develop a neighborhood grant program. This initiative includes community-based health clinics in areas with high social vulnerability and disparities in health access and outcomes.
And then mentioned at the beginning of this presentation, we have one last slide on the fiscal year 2023 supplemental. As mentioned, the State Budget Office has advanced to the legislature supplemental request 2023-6. The total supplemental request is $444 million. Again, no general fund included in the supplemental request, just needing the authorization at the appropriation level. So with that, we can go ahead and open it up for any questions you may have.
Thank you so much for your presentation today and for your work. I'm going to kick off the questions and ask, I'm interested in more information on the $100 million proposed for clean water. Can you tell me are there programs in place? Like, how will this $100 million be spent?
Yeah, I can kick that off and certainly turn it over to Dr. Leinkill for more detail. But the $100 million is inserted in the budget as one-time funding. So it would expand on some of our existing programs, whether filter distribution or in-home lead abatement, testing and abatement. So we know that, as mentioned, a lot of the water infrastructure needs are longer term in terms of actually replacing the water infrastructure. But in the interim, there are those steps, whether filters or other steps that we need to make sure that we take to address the immediate needs. Anything you want to add?
Okay, any questions from the committee? Representative Price.
Yes, we are anticipating as many as 400,000 Michiganders losing their Medicaid health coverage this year as pandemic federal protections fade away later this month. I'm wondering what the impact would be on federal health if this population remains uninsured.
Yeah, that's really a great question. I know we had kind of our Medicaid program area here previously, who can go into a little bit more detail, but I will say, at the department level, we are looking at that very closely on all the impacts, whether it's the health component or it's the food component. I know we have some of our partners that will be speaking later as well. So we know that we have to address this comprehensively. Be happy to follow up with any more specifics, but it is definitely something the department's taken very seriously.
I'll just ask one other question. So the budget proposal for more support for local public health departments, how will this funding get distributed to communities? And what are your thoughts on the sufficiency of the funding proposed to really allow them to provide everything they need to in the public health sphere?
Yeah, great question. We currently do have grants with the local health departments, so we would build upon the existing grant agreements that we have with the local health departments. And as far as the sufficiency, I would say that, this is definitely a step in the right direction. That we know there's continually more that needs to be done, and we do believe this is a step towards that right direction.
Thank you. Rep. Meerman.
Thank you, Chair. Wanted to talking about the construction of the consolidated laboratory. Could you kind of describe to me what we have now and what we're expecting to get once this is done?
So currently, we have our state public health laboratory is located out near the airport. That we have been in that facility for a number of decades. We were fortunate to receive some funding to be able to expand that facility, but I can tell you we are absolutely bursting at the seams even with that expansion. What this does is build a laboratory in the state secondary complex that would include not just the state public health laboratory, but would also include other departments' laboratories. So it provides some consolidation, which gives us some efficiencies there. What we are anticipating is this enables us to meet the needs that we will have 15 years from now, 10 years from now, in terms of addressing new technologies that may come in. Also, as we need to surge up, as we did for the pandemic, but we also have to surge up when other kinds of communicable disease events occur, it gives us more flexibility to do that in a safe and efficient manner.
Thank you.
Rep. Skaggs.
Thank you, Chair. Just wonder if we can go into a little bit more detail on the proposed supplemental, especially the two other big ticket items, the home and community-based services and the public health emergency workforce grant.
Yeah, so we've included the home and community-based services as it's all part of the overall package. That one specifically is not related to the Public Health Administration, but rather is related to Medicaid in that area. So we'd be looking at expanding additional services there. The other areas that are highlighted are specifically related to the Public Health Administration and would assist with providing the necessary framework to make sure that we're able to respond to public health issues as we move forward. And we can certainly provide any more detail on any of the items if needed.
Yeah, that wasn't a ton of detail, so yes, I suppose a little bit more detail would be necessary. And what about the workforce grant?
Sure. The Public Health Emergency Preparedness Workforce Grant enables us to continue some staffing that has already come in for COVID, but also to strengthen our staffing that we have for addressing communicable disease outbreaks or the next pandemic as well.
So this would be money that would be going to county public health departments that they'd be applying for these grants?
So,
Or is it internal to
if
the
I'm
department?
remembering correctly, some of the FEP dollars have already been distributed to the local health departments. There is an opportunity to, of course, provide more dollars there out of what is available in that pool.
Okay, so if I could get a few more details on that, that would be preferred. Thanks. Thank you, Chair.
Rep. O'Neill.
Thank you, Madam Chair. Thank you for being here today. In reference, kind of following up on my colleague Skaggs, in terms of the support for our local public health departments, I'm sure you're aware that there's a statute that requires a 50-50 funding formula for our local health departments. I think last year when we started talking about this, I know we were like at 21%, and I think we worked our way up to like 40-something%. I'm not sure if it's gone beyond that, but I'm very interested and concerned about the fact that we have not met that 50% threshold in terms of the formula. So I would be interested to see what your budget recommendation would be to accommodate that, because that's extremely important. That's ground floor level service to make sure that our health departments are funded at the statute that our state requires. Being a former commissioner, last serving in Saginaw County, we were backfilling our local health departments to the tune of $1.5–2 million annually because of that deficit. So I think that's a very serious area for all of us across the state of Michigan to make whole our local health departments to the statute that's required. So if you can address that now, or be aware that that's a very, very important issue that we're all concerned with. The pandemic showed us that you know, during that time, most of our health departments were scrambling to accommodate the needs that were present to the pandemic. So, Madam Director, if you could.
Yeah, we definitely appreciate the comment and agree with you. Really, those local health departments are, like you said, the boots on the ground and our partner as we move forward. Certainly, the funding will, as I mentioned, move us forward, but we are also concerned about getting to the 50%. And so we'll go back and make sure we follow up in terms of what the funding level would get us to.
Thank you. Thank you, Madam Chair.
Seeing no further questions, thank you so much for your presentation today. We appreciate you and the work you do. And next, we'll invite up James Rutherford, our health officer, director of the Kalamazoo Health and Community Services, who I had the pleasure of working with when I was a county commissioner. So welcome, Jim.
Thank you, Chair Morris and representatives for the opportunity to come and present today. Can you all hear me all right? Okay, great. As Chair Morris indicated, my name is Jim Rutherford, and I am the health officer with the Kalamazoo County Public Health Department. I've been in public health for about 33 years now, all of which have been within local public health. I started at the Mid-Michigan District Health Department.
Hold, Jim, 1 second.
Oh, that'll help.
Okay.
Even better yet. I started with the Mid-Michigan District Health Department, spent time with the Berry Eaton District Health Department, Calhoun County Health Department, and then I'm currently serving as the health officer again in Kalamazoo County. So, you know, there's a lot of different definitions of public health, and I ran across this one, and I thought it was really quite succinct. Public health protects us all. Broader than health care access or affordable coverage alone, public health is central not only to the health of individuals, but also the health of their communities. Public health encompasses infectious disease control, environmental safety, health behavior change, quality food and water, in addition to social determinants of health or non-medical factors influenced by the conditions in which people are born, work, age, live, and die. Broadly, public health prevents disease from occurring in the first place, promotes physical, social, and environmental health, and protects entire communities through sound policy and programs. We garner our authority to provide public health services within the Michigan Public Health Code, which many of you know is an act to protect and promote the health and welfare of the community in which we serve. As Sarah had indicated, there are 45 local public health departments in the state of Michigan. There's a variety of single county health departments as well as regional health departments. Each health department is required to have a health officer and a medical officer. There are mandated essential local public health services that every local public health department has to provide, including food protection, private groundwater, public water supply, on-site sewage disposal, hearing services, vision services, sexually transmitted infection control, immunization, and infectious disease control. Every local public health department is accredited every 3 years for performance measures. Obviously, beyond just mandated essential services, local public health departments provide a variety of services outside those parameters. Beyond administrative and operations, many of us have, we all have obviously personal health divisions with clinical services. We have environmental health divisions, WIC programs, maternal infant health, epidemiologists. Some counties don't have an epidemiologist, some do. Health education divisions, some have a broader representation with health education. Emergency preparedness, every local health department now has, since 9/11, has emergency preparedness divisions. I oversee the area agency on agency or on aging, which is unique to Kalamazoo County. I also oversee the veteran services. We're fortunate to have one of the regional laboratories, and I think there's about a half dozen of those in the state of Michigan. I oversee the medical examiner program. We're very fortunate in Kalamazoo County to have a household hazardous waste facility. Some health officers oversee animal control services. Lead abatement programs vary within the state, as well as healthy home programs. So funding for public health, my recommendations at this point in time is to continue to maintain recent increases in spending for key state and local health functions like laboratory services, epidemiology, and some local health services. This paid significant dividends throughout the pandemic. The funding that has been invested in both child and adolescent health services and prenatal care outreach need to continue as well. And we are very appreciative of all of the additional revenue that we've encountered or experienced as a result of the last couple of years. Essential local public health services funding, unfortunately, has remained flat for decades. When we talk about the 50-50 cost share, that's exactly what we're alluding to. This is a great, I think, representation, and there's a document online. It's called, it's from the Michigan League for Public Policy. It's called Local Public Health Funding in Michigan, an evergreen need even in our new normal. And this was published in June of 2022. I wholeheartedly recommend going and reading this. It's a very phenomenal document with a lot of good recommendations. But this is something that stood out to me, is that Michigan ranks 40th for per capita funding, which means that we spend $83 per resident in the state of Michigan. The national average is $116. So we have a lot of I think, room to grow here. When we talk about what local public health needs, you really, when you've seen one local public health department, that's exactly what you've seen, one local public health department. Needs vary depending upon, a lot of times depending upon your zip code. In essence, funds should be distributed, our recommendation is funds should be distributed as a block grant to local public health to meet the intended flexibility to address local health department needs. And, I'll tell you, just in the last 6 years in Kalamazoo County, what I've encountered as a local health officer. We dealt with Eastern equine encephalitis, which was a significant issue for Southwest Michigan. And then shortly after that, I shut down an entire water supply because of the first PFAS contamination of a municipal water supply. That was first in the United States, pretty significant issue. And then we transitioned into COVID. So it's been a pretty significant 6 years. But it's the resources, the relationships that we need with the state health department that really pay dividends in terms of how effective we are at addressing those types of issues. So if, for instance, we were to receive block grants, in every health officer would probably do it differently, and nobody knows their health indicators better than a local public health officer. So the autonomy through a block grant for some of these supplemental funds would be really, I think, quite a great step forward. For instance, we have a lot of gun violence in our community that we need to address. When Representative Morris was in Kalamazoo County, we put forth a resolution that identified gun violence as a public health threat to our community, because that's exactly what it is. Funds to be able to address gun violence or to be able to help address gun violence. I have one public health educator. When I started, 33 years ago at Mid-Michigan, we had a dozen health educators. Those have fallen by the wayside. Health educators help to disseminate information. They're out in our community. And the one health educator that I have is so restricted because it's grant-based that is specific to that respective grant. So all that she can do is sexually transmitted infections. So, I should, a county my size with a 250,000 residents, we should have probably 4 health educators. We're fortunate to be able to fund an epidemiologist, but there's some counties that don't even have an epidemiologist. Imagine that. To not be able to have that resource is just not acceptable. We look at programs, and when I go back to health indicators, every county is different. I have in Kalamazoo County, while we have resource, we have some unfortunate health indicators, and a lot of them deal with inequity. They deal with the fact that black babies are 3 times more likely to die before the age of 1 than white babies. That's pretty significant. We have a very high rate of teen pregnancy. We have a high rate of sexually transmitted infections. So, block grant would allow me to really focus on the areas that I know I need to focus on within my respective community. Somebody up in, upstate, up north would have, different opportunities based upon the needs within their respective communities. So with that, I was told to keep it short, and that's exactly what I did. Any questions that you might have, I can hopefully try to address.
Thank you, Jim. And I can say that watching Jim work through COVID and the incredible infrastructure that the county put into place to work through, the immunizations, the testing, what you went through from the community perspective. I'm glad you're still here because it takes a really tough person to really work through all the just very difficult issues Jim has faced as a county health officer in the last few years. So, Jim, I'm personally very grateful for your work and that you are still here. And Rep. Green has our first question.
Thank you, Chair. Is it okay if I ask 2 questions? Thank you for being here today and bringing issues up. You've had a lot of experience in local health departments in mid-state as well, which my district is part of mid-state. Can you, over the course of your career, can you let us or give us a window of insight into how when the funding has increased from the state, how that has affected the local health departments and their responsibility and their oversight by their local county commissioners and local communities? So as the state has increased its pot of money, where have the loyalties lied?
Well, part health officer is there's some politics associated with it, and that's just, I'll say this, it's an unfortunate reality that we encounter. There's I'll use an example. A family planning program in Kalamazoo County basically provides low income families access to good birth control. That's controversial for some politicians, obviously. So just trying to balance that is a challenge. Even the grants that we go for, there's some challenges in terms of how best to be able to accomplish that. But at the core root of it all, and I'll use an example, when we don't fund essential services, when I don't have the number of nurses that I need, when I don't have access to epidemiology and data collection, when something happens like a COVID pandemic, it's problematic. It's significantly problematic. And I can't fix that in the middle of a pandemic. I can't hire nurses. You can throw $1 million at me at the local level, and I can't hire nurses during the middle of a pandemic. They just don't exist. And I can't compete with the entities that are being able to hire those nurses. So having that central core of employees is really imperative, and not doing it in the middle of a pandemic, but doing it at a point in time when it's consistent and useful throughout the duration.
Thank you. Sort of as a follow-up with that, you're asking for a block grant, and you're talking about different things. I'm from a part of the state that we had a pandemic. We live with EE. That's why we spray for the mosquitoes. My locals are going through the exact same things. We're struggling to get, you're talking about you're having an epidemiologist. We'd love to have some. So when we do a block grant, how do we tell other communities that are in the same health network that, sorry, this one needs it more?
Well, what I envision, and again, this is a broad perspective, but what I would envision is a fair a fair appropriations, and that can be a per capita appropriations, that you allot to local public health departments that afford them some autonomy in terms of how that money is allocated. So that, you know, and I use the term block grant for lack of maybe a better term, but really to say X amount of dollars are going to each local public health department and allow them the autonomy in terms of how they're going to utilize that. Now, you know, there can be mechanisms in place to assure that it's done appropriately and that every county is applying that in a manner that they should, and that, you know, there's follow-up associated with that. But just, again, that autonomy that it doesn't currently exist. It does in the forms of, if I want to go for a school-based health center, I write a grant for school-based health. But to have some supplemental revenue that allows me on an annual basis to address those issues, those health indicators that I have that are specific to my jurisdiction would be, I think, of value.
Rep. O'Neill.
Thank you, Madam Chair. Mr. Rutherford, I appreciate your candor. And, you know, you just put it straight so everybody can understand it. And you brought up the point that I made earlier in terms of how important that base funding is. I mean, at the bottom floor, as a state, we have to take care of that 50-50 formula, and gives you, as you indicated, the autonomy to make those decisions, you know, as you need it. So thank you for that, and appreciate all the work you're doing.
Thank you.
Thank you, Madam Chair.
Rep. Hood.
Thank you, Chair, and I echo my colleagues' comments. Thank you for the good work that you have done, and hopefully will continue to do over the next steps in your career. I am a champion of reducing lead exposures, and I know that your community, like mine in Grand Rapids, struggles with this issue. I'm very thankful to have another colleague, Representative Rogers, who's not here on this committee, but serves as chair of health policy. We've been working to advance lead legislation. What might be most helpful to you over the coming years to advance solutions for families to reduce lead exposure in Kalamazoo County? And are there key legislative actions that you would like to see us undertake, or investments that you'd like us to focus on as we move forward in our work here?
That's a great question. And, you know, most communities have lead-burdened housing stock. Particularly communities that, you know, are larger. You know, a basic reminder to people is that, you know, Flint, I think, put a lot of people in the mindset that it's in the water. And while it is, you know, in the water in certain jurisdictions, more often than not, lead exposure for elevated blood lead exposure in children is really the result of paint. For homes that were applied with paint that had lead in them before 1978. We've got houses in our state that contribute on a regular basis to lead poisoning with children. It's a vicious cycle. And this is affecting our most vulnerable residents. These are people that rent, low income, oftentimes single moms, that don't have anywhere else to go. So they go to these houses that have not been remediated of lead. It's ongoing, and it's been ongoing for decades now. In any given month in Kalamazoo County, we'll be managing close to 60 to 100 lead-burdened, you know, in situations with children that have been exposed to lead. You know, we've danced around this for decades in the state of Michigan. We really have. Oftentimes, what happens is the child will get exposure to lead in the home. The testing, you know, the testing that we do is not enough in the state of Michigan as well. But the testing represents, you know, this child's got lead burden, and you know, will begin to respond. Oftentimes, that house is not remediated. The lead burden does not go away because of the cost associated with remediating the lead problem. Oftentimes, that cost exceeds the actual value of the house. So when you've got, 45 different, or I'm sorry, 80-some different counties in the state of Michigan, you're doing it 80-some different ways, unfortunately. And then you've got municipal governments that are involved in terms of their housing codes. We're really not addressing the issue in terms of remediating the lead in the homes. And until we do that, we're not going to be able to, make this problem go away. So it's not an inexpensive fix. It's a very expensive fix, oftentimes dealing with landlords and tenants, but it is something that should be addressed.
Thank you so much. Couldn't have said it better myself, and please consider us partners in the effort to advance solutions in your community and across the state. Thank you.
Thank you.
Seeing no further questions, thank you so much, Jim, for being here. Really appreciate you and your work. And lastly, we will call up Dr. Phil Knight, Executive Director of the Food Bank Council of Michigan, along with Ana Almanza, Director of Policy and SNAP Outreach. Please just make sure your mic's on.
I'll leave that to you.
Good morning. Is it on? Yeah, okay, great. Well, thank you for the opportunity to be here with you. Anna has a brief PowerPoint here, and I think you have copies of that. I guess the first word I'd like to call out to you is investing, that you see on the slide, and that's really what this is. It's an investment in people here in Michigan who are struggling with the toxic stress of living a food insecure lifestyle. So thank you for having us today. It's an honor to be here with you. We'd like to talk with you just a little bit about the Food Bank Council. We are, probably the best way to do this is numbers. There's one Food Bank Council. We represent the 7 Feeding America food banks that serve all of Michigan's 83 counties. And we do that through a network of almost 2,800 different pantries. And I think Representative Martis, your family has one of those pantries in the Flint area as well. So thank you and your family for that. And we kind of, listening to the other presentations, saw 2 instances where the community really, the state really relied on the Charitable Food Network. And that was during the Flint water crisis, where we worked hand in hand with Michigan State University Extension, where they did the education part about the lead exposure. And then our food bank, the Food Bank of Eastern Michigan, supplied the food that would mitigate the lead exposure. And then during the pandemic, the most food we had ever distributed prior to the pandemic was about 165 million pounds of food in a year. But during the pandemic, we grew our infrastructure to support the distribution of 237 million pounds of food in just 12 months. So we represent the 7 Feeding America food banks, and we're pretty excited to be here with you because we think this problem is solvable. And one of the reasons we think that way is because if you don't think that way, if you don't think that a problem can be solved, you'll never think about solutions. You'll just think about management. And so we want to think about how do we imagine a community that doesn't have any food insecurity. And if you look across the state of Michigan, and you see free or reduced lunch or breakfast in a school system, then there is food insecurity in that community. And our mapping shows us that it's in every community in the state of Michigan. And it's just a problem that it doesn't have to be this way. It is a solvable problem, and we want to work at that. So we have 1.1 million people in Michigan who are struggling under the toxic stress of being food insecure. About 47% of the people who come to a food bank for emergency food distribution have someone in their home who's employed. 23% are children, 19% are senior citizens, and about 6% are homeless. That's the vast majority of the people who come to see us. And I think there's something we could all agree on, and there are 2 words that should never go together, and that is children and hunger. I haven't met anyone yet any place yet that I've ever been that thinks that children and hunger should go together. And that's our vision. That's our mission, to create a food secure state where no one is struggling with where hunger comes off the table, and people have the freedom then to their minds are free. We say if you're hungry, you only have one problem. That's because your mind is held captive by that toxic stress of food insecurity. You're not free to think about what could be next, or how do I achieve self-sufficiency so I don't need charity or the government. And I think that's what we want to do, is take hunger off the table for these folks that are there. So there are some challenges some of our families in the state are experiencing, and I'll run through those really quickly. One, as we're experiencing as we try to serve the families, one is the supply chain. I think everybody knows about that. We used to buy some food out of our cooperative in Arizona, and we would bring that during January when there's not a lot of food in Michigan, and that truck would cost us about $3,000 to bring that food into the state. Now that transportation costs us about $8,000. So we need to shorten the supply chain and buy as much of food as we can here in Michigan, and even create some individual quick storage. And Representative Green, your dad, he worked with us on that to create that. So inflation is a huge hindrance for us now, not only the families, but I never thought I'd be paying $7, $8, $9 for a dozen eggs ever. But that's what the reality is today. But inflation not only impacts the families, but it also impacts the food banks. The money that we have in order to buy the food that we're not getting from the USDA presently, then that money's not going as far because of inflation as well. And we're pretty good shoppers. I mean, our average price for produce is like 16 cents a pound. So we're pretty decent shoppers on that, and we're battling inflation. And then the other thing is that we have not received the food we normally get from the USDA. The first quarter last year, we got 6.9 million pounds of food that we could distribute. This first quarter, we got 1.5 million. And we understand that that's really not going to pick up until later in the spring and early summer. And then the last challenge that we have is most of you know, we lost the emergency allotments on SNAP at the end of February. And the impact of that will be about $130 million per month in the Michigan economy. On average, SNAP recipients will lose about $93 per, and I think there are some seniors who will be hit very severely. If they've been receiving $250 a month in food assistance, many of them will drop down to the minimum, which is $23. So what happens then is they come to the charitable food network, the food banks, and our pantries, and the challenge for us then is that charity becomes the safety net to the safety net. And so that's one of the reasons we're here, so talk about an appropriation so this time next year, we're not in the same predicament that we are right now, where food banks, particularly Gleaners in Southeast Michigan, is spending about $1 million a month to buy the food that the community needs. And we just in charity cannot scale that or sustain that. So we brought a problem, but we also have an answer, and that's called the Michigan Agricultural Surplus System, MASS. It's the first program of its kind. It has now been duplicated in 39 other states. And what we do is take that grant from you, and we go directly to Michigan growers, processors, and producers, and we buy directly from them. And then we put that fresh food right into our distribution network. And about half of the food, not quite, but about half of the food that we distribute every year is fresh. And so the impact of this program is felt here in Michigan in the agricultural industry, and also for the families receiving that fresh food. And I'll ask Anna if you would talk about that impact.
Yeah, absolutely. So to share a couple more details about MASS, so it allows us to purchase what are called B-grade seconds, number twos, or what we affectionately call uglies, perfectly edible, nutritious items that would still be very much welcomed at most of our tables, but maybe Meijer or Kroger don't find them aesthetically pleasing. They're not the right size, they're not the right color, they're not the right shape. So Mass allows us to purchase from our farmers at a discounted rate. So no farmer is going to get rich, unfortunately, from working for Mass, but we're able to cover their production costs. So rather than these items that may normally go to the landfills or would be left there to rot, we're able to cover the costs that they had to spend in growing and producing those items and allow them to move that food to nourish their communities. So the impact for us, we feel, with the $2 million that you all give us in the current light item that we have in the MDHHS budget is significant. As Phil mentioned, our average cost is about 16 cents per pound. That can vary from item to item, but it is a huge return on investment, we believe, for the $2 million that we receive. To give an example, in our most recent fiscal year, in fiscal year 2022, we were able to take that $2 million and purchase 8 million pounds of fresh food from Michigan farmers and producers. So that's those fresh fruits and veggies, that's dairy, that's eggs. These are staples that our families are coming to us requesting at the pantries and distributions. In the last 5 years, Mass has allowed us to rescue 42 million pounds of fresh food from our Michigan farmers and producers. So it's a program that we at the Food Bank Network feel really proud of, but our farmers that we work with, it's a network of over 120 farmers across the state of Michigan that are really proud to work with us in this as well. So I'm also going to jump to another sort of solution-based item we'd like to share with you today. We have a food and other resources helpline that we operate through the Food Bank Council of Michigan. So anyone in Michigan that may be in need of connecting with local food resources or food programs that are operated by the government, such as the Food Assistance Program benefits, they're able to call us. We're able to help them apply and enroll in those programs, as well as connect to some community-based resources through our network. So this is a program that we've really had an opportunity to invest in the current fiscal year. We were given a one-time appropriation in the current budget. And this is something that we feel like is the essential connecting piece to making sure that people have access to the information and connection piece to these various programs, rather than asking people to go from point A to point B to point C to connect to these programs. They're able to call the FOR helpline and connect to any of the programs they may be eligible to get them food as soon as possible. So this is two programs that we feel are quite worthy of investment as we think about public health. Food security is an essential social determinant of health of really moving our state of Michigan to an area where we feel like we've got residents that are thriving. So we are asking for our current appropriation of the Mass program to be bumped up from the current line item of $2 million. We are asking for $20 million. We are also asking for $850,000 to be able to have sustainability for continued operation of the helpline that we discussed. As Phil mentioned, we feel like investing in our local Michigan agriculture. We're the second most agriculturally diverse state in the country. We've got some tools that other states can't say that they have. We'd love to be able to shorten our supply chain, be able to buy more local directly from our Michigan farmers and producers, not only to address some of the issues that Phil alluded to earlier, but prior to the pandemic, we knew that if we had access to additional resources, we have the infrastructure to move that. Food safety is a top priority for our network, and we believe we can get more fresh food out to communities that are asking for if we had the resources to do so. So again, we've got our network of over 120 farmers. This year we were able to purchase from 46 of those. We'd love to be able to have the resources to purchase from all of them. And that would be able to bump us up to the potential to purchase and distribute an estimated 80 million pounds of fresh produce, dairy, and eggs across our state, which would help to contribute to over 65 million meals. And again, going back to thinking about barriers and that helpline being an essential piece, we already have individuals calling us expressing the barriers that they have to access. That helpline is an essential piece to be able to get people to food. With these additional resources, we want to be able to connect those seniors and individuals with disabilities that are calling us looking for food today. We would love to dedicate $5 million of that $20 million specifically towards the innovation work that we are doing currently to be able to offer fresh food to seniors across our state. And I think with that, we tried to keep it as quick as possible, but would love to take any questions you may have.
Well, I told my preacher Sunday that I never heard a bad short sermon, so we want to honor your time.
Well, unfortunately, our time is so limited always here, and we're trying to get as many people through as we can, so people really get a broad view of what we're trying to do here with this critical budget. So thank you for the work you do. I know we are at a critical time in terms of the SNAP benefits ending and the extra COVID programs coming to an end, and there's going to be a lot of people looking for help. And I appreciate that you are filling a gap there and doing that. So, and I also appreciate the fact that you are using our farmers and what they're producing. I mean, I really appreciate that, and I think that is just really compelling, a compelling argument for this. So if there are any questions? Representative Martis.
Thank you, Madam Chair, and thank you both for being here. It's not very often when I look at the list of presenters that I kind of nerd out and get excited about somebody that is presenting, but I think, Dr. Knight, you are one of the best advocates and explainers of food insecurity that I have ever seen. I've seen the work that you've done with my mom, who runs the Flint Farmers Market, my dad doing some things with the water crisis, my relatives who started the Martis Luna Food Pantry. I'm the least impressive member of my family, and just from the stories that they've told and from our interactions in the past, you are just again, the best champion of this. And I think sometimes it's important for people to understand the people behind the policies or behind the politics. And I was wondering if you could share a little bit about why this has been the cause of your life, why it has been such a passion for you. I think that you, again, are just such an important advocate for this. And if you could take us through a little bit, why is this the reason why you get up in the morning? Why is this the cause of your life?
Well, thank you. It's a great compliment. I think you're probably talking more about Anna than me, but so there's probably a couple of instances in my life that compel me to do this work. I'll just share briefly one. And, I think we all have difficulties in life. Mine came in the form of a life upset where I ended up with custody of 2 young boys, full custody of them, and found myself in a place in life where I really kind of had to reinvent myself. And, I was a minority in that in 2008, I moved to Michigan. Most people were going out, and I was coming in. And I have a doctorate degree in philosophy, which at no time will help you get a job. And particularly in a recession. And in 2008 and 9, I found myself in Michigan with 2 young boys, and I couldn't find a job. And so I worked at Walmart. I still have a name tag that says Dr. Phil on it. And the school counselor said, "Phil, I think that you guys might be approved for SNAP." And so for 18 months, me and my boys were on SNAP. And I don't look like the face when you think of someone that's hungry. And I can tell you that first trip to the grocery store, we had $98 and we spent $97.69 on meat because there were 2 boys. And it was a benefit. So I do this work because I've been this person. So thank you.
Thank you so much for sharing that. Representative Steele.
Just real quick, the increase is huge. It's like 100% increase of your ask. And I know inflation has a factor in the increase, but I was just wanting like a number, like we feed X amount of families now, we want to feed an X amount of more, or per person, something to that effect, just to see the extraordinary increase in ask. Thank you.
Right. We'll be happy to furnish that. Anna?
Yeah, I'd say we don't have the breakdown of per person, but we do have a breakdown of sort of in pounds and meals that we're trying to get a little bit more innovative at the Food Banking Network of really understanding at the household level what that looks like, but traditionally that's the language that Food Bank speaks is in pounds in truckloads and meals. So this, currently with the 2 million, we were able to provide 8 million pounds of fresh produce across our network of that almost 3,000 pantries across the state. And that was a little over 200 truckloads and 6.7 million meals. So with that, decent size increase, I would say it would allow us to really increase that exponentially to be able to offer 80 million pounds of these fresh items, 2,000 truckloads that could go to possibly areas of the state and communities we're not able to serve currently, and that would be close to 65 million meals that these items would contribute to. So we do feel like that would be very much worthy of investing.
And I would say, sort of where are the goalposts, right? When is enough enough, whether it's government program or charitable programs? On our website, we have published a study called the Self-Sufficiency Standard that looks at 719 different household types across all 83 counties of Michigan, and it shares with them, no matter how the ages of children, you can put that in the template and it'll tell you what your household budget should be and what you would need to make per hour, per week, per month, per year. So in Ingham County, if you, for example, if you have a single parent with a preschooler and a school age, they probably need to make about $24 an hour, not to need charity, not to need us or you, government or charity. And so if someone's making $16 an hour, we've got an $8 an hour gap there. And so this type of investment in that person helps bridge that gap for them. So if that's worth $2 or $3 an hour, then we're bridging the gap. Part of the problem is in this hunger cliff, we have a benefits cliff. So once someone makes X number of dollars, I think it's $13.50 an hour at last I heard, here in Michigan, they go off the benefits cliff. So no housing help, no child care, and no food assistance. And so what we end up with in a federal policy is we disincentivize work. And that's what we should have, a policy that would stretch across that wage scale until someone becomes self-sufficient. And those benefits would tailor down as their money rose, but it would be an incentive for people to take extra hours or extra education in order to improve their station in life. So that self-sufficiency standard is available on our website, but we'd be happy to furnish a thumb drive for that for the office as well. Mm-hmm.
Rep. Hood.
Hi, thank you for being here, and thank you both for your good work. It's so important. I appreciate your commitment to purchasing local foods. We know that they're healthier and full of more dense with nutrients for people. Yes. And of course, we get that double whammy of helping our farmers have dependable income as well. That's not my question. My question is about college students. Through my work here in Lansing, I have been made aware of the insecurity of college students. This is a particular population that we were able to advance supports for during COVID, and I'm curious to know if you're aware of any efforts to make sure that this population of food insecure persons in Michigan is supported as we exit the pandemic.
Yes, it's a great question. Thank you for it. So we would say that if they're not well fed, they will never be well read. And that's in third grade and in third year. And one of the first realizations we had about food insecurity on the college campus came from Northern Michigan University. And we understood that from a student survey there, over 43% of the students were missing meals during the week. On average, out here in this world, a food insecure person misses 3 to 4, on average, 3 to 4 meals a week. And the problem is it doesn't average, it bunches. So they might have enough resources for 3 out of the 4 weeks of the month, but the last part of the month is really tough. And so they're out of food, and they're food secure for 3 weeks, but they're food insecure for that 4th week, and that's where we come in. And that story gets told over and over and over and over on the college campus. They've got enough for part of the month, but they don't have enough So 43% of the student population in Northern Michigan University were missing meals. And so we have worked with our universities, and we are establishing food pantries on every major college and university here in the state. So we're not there yet, but we're working on it.
If I may add a little briefly, you touched on sort of those investments that were made at the federal level to expand, and also here, the current administration had expanded some state options that allowed college students to have greater access to SNAP benefits. That is one of, as we talk about the unwinding of the public health emergency, so we follow that quite intimately at the Food Bank Council of Michigan because we are a formal SNAP outreach partner of the Michigan Department of Health and Human Services, which allows us to operate that helpline we talked about. So two of those flexibilities that provided greater access for college students with limited resources are going to be sunsetting with the end of that public health emergency. So there will be a 30-day window after the May 11th date, June 10th. Those additional flexibilities will come to an end. So we are actively working with our partners of food banks and our agencies across the state to share information to hopefully engage with those students that may be eligible through that expanded eligibility right now. I would love to follow up with your office if you would love to have that information and help support us in sharing that information. But again, goes back to, we want to be able to connect food insecure households, individuals, to all of the resources they may be eligible for, whether it's through our network or government assistance programs. So we want to create greater access with SNAP. We'll be fighting for that in the Farm Bill, but also make sure that our food banks are being able to support those pantry networks at those local universities and colleges is important as well, and MASS could help support those efforts.
Yeah, that's wonderful. Thank you. And please do reach out and provide additional information. We can share it with colleagues as able. I'm sure others are interested in it. Let's help those kids through what I once called Ramen Week. Thank you.
Again, thank you so much, Dr. Knight and Anna, for joining us today. It's really important information. We really appreciate all the work that you do as well. And thank you, colleagues, for your questions. If you have any questions for Dr. Knight or Anna, please forward them our way, and we will make sure they get passed on. So let's see. Rep. Meerman moves to excuse absent members. Hearing no objection, absent members are excused. And seeing no further business, this meeting is adjourned.